Celia Poon-King. I'm a public health specialist. I live in Trinidad and Tobago, and I participated in the Leaders in International Health in 2009 and was asked to become a mentor in 2010, and so that's what I've done for this year. I was mentor to the Caribbean group of participants. I've been asked to identify 3 international health topics that I think will be in the forefront, I think, for the next few years. I think I can only do it from the perspective from which I come, which is the Caribbean perspective. Things that are going to impact on us and are impacting on us. I would think the first thing we would need to look at or identify as an international health issue is, I think, human resource. And that will tie into the second thing that would identify after. I'm not sure that people quite appreciate that when you come from very small communities, the health services you expect in a small community is the same that you would expect anywhere in the world. And just you have less numbers of people to supply that service. And therein lies our problem. We are very small communities trying to identify or supply a service that is second to none. And in a lot of things we actually do. We pioneer a lot of areas, mainly because we have no other way to get what we need. And so we go out and we find ways to do it. And so human resource is an issue because we have had to identify the fact that we do not have human resource. And so we've trained, and then people come and take people you've trained because you've trained them so well. You train them well because you have no other option. And you train them in the fact that you have limited resources, so you use them to the best of your ability. Now, building on the fact that we actually have limited resources, both in humans and, I would say, money, capital, it also means the second point that also impacts directly on our communities is the fact that our health systems will need to be strengthened, because the fact that we don't have or we have human resource losses to our communities means our health systems are quite prone to that loss. And so it means health system strengthening would be another issue, I think, of international health topic that would be important. And then the third one, I think, is it ties all of it up together. Well, the first two as well as the, brings in a new element. And I would say it would appear to be different, but it isn't. Because I think climate change, our communities live in an area rife with hurricanes, earthquakes. There are gaps, and there are countries with dire poverty next to communities that are very rich. And it means we need to learn how to balance the fact that we do not have everything that we would like. And within the concept of climate change, a lot of the things that we take for granted disappear one day. You know, a hurricane comes and your entire economic system has been completely devastated. You know, the very good example would be Haiti. I mean, literally, at the end of one day, there was nothing. But the other thing I would say is that as a community, the Caribbean is very resilient and very innovative. And whatever happens, we always bounce back. And so I think together with the fact that we are resilient, whatever comes at us, we're able to get above. But the issue with climate change is that we can't do anything on our own. You know, climate change for a small country that, you know, feels it. I mean, there's some communities in the Pacific, some islands have disappeared. You know, they expect the water levels to rise. In some of our countries, it means we lose land. It's not a case of just losing land. You lose the ability to communicate and move around and live. So I think, you know, Guyana has been very progressive in its issues as in trying to deal with climate change and making it more than their issue. You know, you're saying this and they say fine, it means this. And as a community, we have to appreciate, you know, Barbados has one of the highest levels of solar panel water heaters in the world. You know, that's because that government took the opportunity to support that movement. And that's what we have to do. We have to appreciate as a community that climate change has started to affect us and has been affecting us. Mm-hmm. And we need to identify that small as we are, we need to get everybody else to understand. You know, it's not just decreasing your levels of carbon use and things like that. It actually means our life as we know it is going to change tomorrow because of what you do and what we do, and we need to do something about it. So from the point of view of international health, I think of all of the three, that actually encapsulates everything, because if a hurricane comes, it means the health system is completely devastated and the people we already don't have. Mm-hmm. So it's completely thing.